Hello, my name is Ashra Khanom. I am a research fellow at Swansea University. I am pleased to have this opportunity to present the INFORM study, which is Improving Care for People Who Frequently Call 999, a co-production of guidance through an observational study using routine, linked data and mixed methods. This study has been funded by Health and Care Research Wales as part of their fellowship programme. I will begin with the background to the study and then report on the methods. We know that 999 ambulance services are under pressure to meet increasing demand due to factors such as an ageing population and patient handover delays at the emergency department, which reduces the number of paramedics on call. Within this context, there are some people who make very high use of the 999 ambulance service. They are classified as high-intensity callers, that is, someone who makes 5 or more calls in 1 month or 12 or more calls over 3 months. In Wales, these high-intensity calls account for approximately 5% of Welsh Ambulance Service call volume each month. High-intensity callers are often the most vulnerable people in society and present with complex health and or social care needs, which often require non-clinical intervention. Half of these patients contact 999 for a mental health problem. Other reasons include falls and chronic conditions. Also, poor engagement with primary and social care providers, often due to addiction and social isolation, can lead to additional contacts. Some ambulance services have introduced a multidisciplinary, cross-sector approach to try and address patients' needs and to reduce emergency contacts by working with police, emergency departments, third sector organisations and local authority housing and social care services. The aim of this study is to work with stakeholders in Wales to co-produce guidance for care for patients who make high use of the 999 ambulance service. This mixed methods observational study will review the published evidence to summarise what is already known about patients who call the 999 ambulance service frequently. It will explore the epidemiology of callers using linked health data to describe their caseload, to understand variations in calls geographically, person characteristics such as age, gender, and finally, report on patterns and outcomes of frequent calling. All patients who meet the definition of a high-intensity caller between January to December 2018 will be followed for a period of 6 months from their first index call. This will provide a snapshot of what is going on in a given period of time. Qualitative in-depth biophotographic interviews will also be used to understand how patients feel about the care that they receive at 1 month, with a follow-up telephone interview at 6 months to capture changes and views around care. Focus groups with health professionals will be conducted to understand the perspectives of care providers in terms of service provision and resource use. And finally, a co-produced guidance for optimum care will be created with stakeholders following a synthesis of evidence for use by the ambulance service. The INFORM study complements a related study at Swansea University on which I am a co-applicant called STRETCHED. This study will evaluate the efficacy, effectiveness and safety of cross-sector case management of high-intensity callers across 4 ambulance services in the UK. Thank you for listening. If you have any questions or comments on this presentation, please add them as a comment below the video and we will read and respond to these. I would like to acknowledge the support received from the INFORM Research Advisory Group members and my academic mentors, Dr. Alison Porter and Professor Helen Snooks, and in particular the NHS for supporting this work.